You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space. Ivan, why don't you go ahead and introduce today's guest?
Hi, I'm Ivan Zach, and I'm happy to introduce Shea Cox. Dr. Shea Cox is a founder of PetHospice. She's the owner and veterinarian at Bridge Veterinary Services. She's also a founder and co-chair of Animal Hospice and Palliative Care Certification Program, and she holds a degree of Doctor of Veterinary Medicine from Michigan State University. On the personal side of things, she also holds a degree in Fine Arts and Nursing, RN on the human side of medicine. A fun fact, her first job was a taxidermist, which I practiced twice to say. And it's an interesting background given the line of work now. So, Shea, can you tell us more? This is very interesting, very needed area of the veterinary domain. How do you get into this business, and what does it look like to run the hospice services?
Okay, that's a loaded question with lots of answers to that. I essentially got into doing hospice and palliative care. I worked as an ER veterinarian for 13 years prior to moving into the hospice space. And it was something that I was seeing more and more happen, just a breakdown in medicine on both the person side and the veterinary side, where clients were coming into the ER, they were lost and confused, they had just seen their veterinarian. And even though they had just seen their veterinarian, they still didn't have a handle on what was happening. And I was trying to understand, why is this happening? Where's the system breaking? And for me, it came down to a matter of time. Veterinarians don't have the time that they need to provide that level of complex care and navigation when it's something more complex. And on the flip side, clients need more time and they're not getting it. So there was this big disconnect that was happening. And I decided to place focus on the end of life sphere and begin offering 3-hour appointment times to people to give them the time that they needed. And people were saying, that ain't gonna work. That is not a successful business model. You cannot do a 3-hour appointment. And I said, well, I'm gonna try. And so I did, and that was 8 years ago and 20 some staff ago. And now we're looking at going into nationwide expansion.
Oh, wow. That's incredible. Yeah. So can you maybe explain? I'm not that familiar, and maybe it's a good thing, to the hospice service on the human side, but I was exposed to it. So my grandmother passed away in October, and she had condition. She was complicated. She was in a metabolic crisis post the relief of the obstructed gallbladder. So anyway, it was a hard space, and I was in Ukraine, which was even harder. And it was a hard space where she was very sick. And then it was decision to go to hospice. I didn't know enough. So what does the hospice and veterinary domain look like, and what it is like to compare to the human, where the similarities and where we're different? Just like, with the onco patients, it's different. We, from what I know is, we're trying to save as much as we can the patient. In human medicine, in veterinary medicine, we're trying to prolong the happy life. So what is it like for animals compared to humans?
Another big question. I think in my mind, coming from a nursing background, so on the human side of medicine, I worked in areas of hospice and palliative care from the human side. So I've taken a lot of this modeling towards the veterinary side. When I break that question apart, I think the biggest challenge on the veterinary side is when clients or veterinarians hear hospice care, it is associated with just that last moment of life, those last few days of life, or it's synonymous with euthanasia. I'll get referrals from veterinarians and they're like, oh, we got a patient for you, needs to be in hospice because, this pet only has a few days to live. And it's like, no, the idea, just taking this from the human hospice side, is ideally hospice should be integrated at the time of diagnosis or at the first sign of decline, because that's when we can do a better job. On, another comparison of differences and similarities is when you look at hospice on the veterinary side, it's either just the veterinarian in that family, or it's either just euthanasia and that small little window of care. Whereas we're trying to innovate this to much more like the human side, where you have a full interdisciplinary team. You start care at the first sign of decline. So like a patient with cancer, when they go to the oncologist, or if they decide not to go to the oncologist, either way, hospice should be brought in at that time. And that's really what we're striving to do. And our model is not just a veterinarian, but each family gets a veterinary nurse in addition to the veterinarian, a care coordinator, a grief support specialist. So we really take that interdisciplinary team approach with care. And I think the big thing about hospice on both human and pet side is it's not just in the veterinary case about the pet, but there's that human component. There's two patients in hospice, and it's never just the pet that we're treating. 80% of what we do is treating the pet parent. And on the other layer of that is we're also helping treat the veterinarian, because what we're seeing in veterinary medicine, I think part of how the system is breaking is you can't do a good job in 20 minutes, and you can't take on these complexities in 20 minutes. And that's what veterinarians are essentially given during an appointment. So it leaves them feeling like they can't do a good job, contributes to compassion fatigue, to burnout, and they are having to do all of this care that we're just not trained as veterinarians to do. So it's this perfect storm of just build up where I think hospice is a key piece of that care puzzle. And, our mission is to bake this into care. We have puppy wellness and we have senior packages, but what about that geriatric and end of life package? Like, that's an area that it's like the redheaded stepchild of veterinary medicine. People don't like talking about it. We don't have the time for it. So this is really where we want to wedge into in that care spectrum.
So how do you get into this cycle? So I'm, similar background. I was an emergency vet for 12 years. And one of the biggest things was I had no idea how to deal with this. And you really become immune. And I think that it was getting close to me getting really burned out, which I did. I did get burned out. But I remember you become cynical. And, these cases, one after another one, you need to get through them. There's a euthanasia, there's a laceration, it's like, we don't think about it, what's on the other side of that exam room door. It's like, it's in our schedule. It's terrible to think that way. But euthanasia, even in human medicine, you don't have that. You don't have on the schedule, I'm murdering a human in the next 20 minutes, and then I'm going to do that. Like, it's just, and I became immune to it as an ER vet. But there was one case where it made me rethink about it, because I had this client. It was, it was a guy about my age. He had 2 kids with him, came in, Labrador, I think like 5 years old. There's a dog that probably ate some sort of toy because he was, had some gastrointestinal upset. And then I did a bunch of diagnostics, couldn't find anything. And I said, one of the tools that we can do, and the dog keeps vomiting. So one of the things that we can do is exploratory surgery. It's just, it's that thing. It's an overnight. It's Vancouver Island. There was no another ER. So we're getting into it. And the maximum I expected, we find nothing, or we find some foreign body. So we get in, and his whole intestine were caked with cancer. It was just like solid mass, like all the lymph nodes, everything. And again, I'm just like, okay, that's fine. So I explained to the guy, and the guy becomes, in front of me, he becomes completely from this kind of, my age, strong guy, 2 kids, happy family, just melts. And then he starts asking me questions that I can't answer. And then, and then he brings in his kids. And then he comes to me and he says, should I bring the kids in for this? I didn't have kids at that point. I don't know. Like, I don't know. Should you not? I have no idea. In that one case, I still remember it. Another thing is that, I calculated on my 7th or 8th year of practice, just an average amount of animals we euthanized. And it was, I think, 2,700 I calculated, just average shifts per. So we're not trained, but yet we have to do it so many times. And I'm really glad that you touched on the point of veterinarians being affected. So what does that look like? How do you incorporate your service, and how do veterinarians find out that that's available and could be accessed as well?
Yeah, all super good points. And, is just why this is such a North Star for all of us and what we're doing is the veterinarian that's affected and impacted. And, being the ER vet for that long, that was what we were seeing. And I think it's about education, awareness, and even though hospice care or the idea of it is growing and becoming more and more commonplace, it's just still not front of mind. So how do you make that happen? And, I stress, the third option, which is hospice. And so many times pets come into the ER, say with hemangiosarcoma, and, been there, done that. It's like, okay, we either do a $5,000 surgery or we euthanize. And I think I had a really unique perspective in the sense when I started the practice in 2008, I spent 2 years sort of cradling both ER and hospice. So I was able to see everything that came into the ER. I would be like, oh, that third option, why don't we do hospice? Or how about we send you home with injectable pain medications and stabilize, and I'll come tomorrow for euthanasia, or we can talk about it. And what was happening is I was seeing time and time again, these patients that would end up being really good the morning of, and people were like, how can we euthanize if, his tail's wagging? So they recovered from a bleed. And it really was eye-opening and, something that to this day, you still carry around this burden in your heart of, when you think of those 2,700 animals that you euthanized, all the what ifs. And I was starting to see all of those what ifs when I was giving that third option. And when we look back at all of our, say, hemangiosarcoma patients that come to us from an ER setting or a veterinary referral, the average time they're in hospice with us is 4 months. So we're looking at the statistics of surgery or doing, or euthanizing, you have 0 months left. So it's been really eye-opening. And, so how do you take what you're seeing and is something that is working so well and educating veterinarians, not educating, but more awareness. How do you bake that into care as that just comes, natural? And, part of our model is that we are partnering with referral hospitals as part of that baked in care so that it's becoming more and more commonplace. So that is how we are structuring, how we're building our practices. And that's what I've done from the get-go, is integrated within a referral hospital setting to become one of their specialties, even though hospice is technically not a specialty, but then it becomes front of mind. So, okay, now how do we do that with multiple referral hospitals? And instead of being, a siloed practitioner who does in-home euthanasia with some hospice, how do we drive this where we are partnering with specialty hospitals and hospice is first and euthanasia is that end result, because that's where it goes, where we are then fully supporting the client through that entire journey, not just one piece of it, and the veterinarian and the pet parent and the pet.
Yeah, it's great. It's really, really interesting. And, one of the things that we always like to dive into, Shea, on the show is how are you leveraging technology to scale this? You're talking about nationwide, and it took me a little while to kind of put your name in my mind and figured out where we met. But we met on the Slack group, on Kinship Slack group, just a couple of days ago. So I'm totally now clicked in. But yeah, how are you guys leveraging technology to scale this? And what does nationwide expansion look like? It's really interesting and is very innovative. So I'd like to hear more.
Yeah, so technology, I love technology. So anytime I get a chance to talk about it, I'm excited. But, a lot of it is telehealth. And where everything changed for me and just my idea and vision for what we're doing happened at the 2017 Veterinary Innovation Summit. And my life just got turned upside down there. And I was in that position of, what am I going to be when I grow up? What am I going to do next? How do I take what I'm doing and do something more with it? And when I attended that and listened to all of the talks, I was looking at what we were doing, which was hospice, and then looking more and more at that and realizing that, 75% of it was non-medical. And it was all of the questions that pop up to the surface again and again of, how do I know when it's time? What does pain look like? How do I prepare? How do I help my kids? How do I help my pets? Similar to the questions you were asked, Ivan, as well in the ER room. And I was like, boy, this is the perfect avenue for telehealth. Could we cleave off our in-home hospice appointments and create a nationwide telehealth service that's focused only on quality of life? And what this does is it also allows us to get around the current VCPR laws, which I don't know if you want me to get on that soapbox or not, but I'm happy to.
Yeah.
And and begin to break into the telehealth realm using that wedge where we can talk non-medical, but then really introduce the idea of telehealth. And then that spun off to, all right, how do we grow this? How do we reach people? And then now it's turning into more of, okay, let's bring our services component along with it. But so telehealth we can use nationwide for people that don't have time. Our focus, our channel is the veterinarians. Like, hey, we know this is tough. We know you don't have the training or the time to answer these kind of questions. Let's take on that burden of care for you. We can be your partner in care. We can help sort of bridge that gap between everything and have those communications for you. And so it's a way that we can reach clients, but we also use telehealth for our medically based consultations. So when we have a hospice consultation, that is initially done in person to establish the VCPR, but then the majority of care is via telehealth until the next appointment, which, obviously is the euthanasia, or we utilize our nurses to go into the home. So bringing in the nurses and really empowering them to do care is a huge part of our model as well.
That's great. So with the telehealth, is that something proprietary, or you partnered up with some platform that you're using?
So we are currently using a bunch of different technologies together. We are currently in the mode of fundraising to potentially build our own platform. Unfortunately, there's not the perfect solution for mobile and telehealth and our model that we're creating. So we may have to create our own. But at this point, we're using Zoom as the technology. The reason we use that is we can record and store those huge video files so that people can go back and watch it again, or if not all family members can be present, they can watch it. So it's a good solution for now.
Perfect. It's interesting. We were just brainstorming today with Shawn, and this is something for our listeners as well. We probably will deploy on Monday a short sort of brainstorm around what can we do for veterinary practices right now, given the whole quarantine around the world, and the telehealth. It's I was thinking about telehealth in that context, and I was not sold on the idea of telehealth just yet, except the unique cases. So yours is very unique. Maybe like a recheck, maybe and recheck is probably not that revenue generating. So I didn't see how the telehealth will be incorporated into their regular workflow. So your case is perfect. But then I think with what's happening now, this is going to force the communities into the telehealth. Interesting example. We're kind of shifting here, but it was interesting. I never used telehealth from the human health perspective, but I needed to recheck and my back hurts, whatever. But right now, everything's shut down. I'm in Ukraine. Everything's shut down, the transportation, subways, everything. But I still wanted to see the neurologist, and we did it over Viber. They use Viber here. It's one of the, it's just like any communication channel, Telegram, Viber. And yeah, they set an appointment for me into my calendar. Like, people starting to adapt really fast. So I think that as long as you're forced into that workflow, it's going to be adapted further. And I think that's really going to help all the businesses that are already dabbling in telehealth. I think it will promote, what's good out of this disaster, maybe there's some other things that will change the way we practice and help us scale and advance our services.
I hope so. That is my silver lining wish for all of this as well, is that this can be a crack in the way we're looking at telehealth, and wedge in there and hopefully make that crack a little bit wider. from the sense of, especially, going back to the VCPR soapbox that I said, I don't know if you want me to get on, but, it's 74% of patients don't receive any care the last 18 months of life. And, a lot of this is accessibility, or they don't think that there's anything that, can be more done for their pets. So we have such a critical population that this is when they need the help most, is that last 18 months of life. And our hands are so tied because we need to establish the VCPR in person by touching that pet. When you think of hospice and end of life, that is less important. People just want symptom management. There's so many examples of just how this could be modified to treat patients better and give better care at end of life and clients.
I think with what's happening right now, it's going to change. We'll have to accept other means of servicing patients and animal needs in the face of this pandemic situation. I think that, it's the topic that we opened up today. We're hoping to actually open a webinar in how can you leverage technology, maybe next week, maybe a little later, but it would be super important to reinvent veterinary medicine very quickly. We've been talking about it. We've been dabbling into it. We have to do it very quickly now. So I totally agree with you. It's been great time talking to you. We have two questions we always ask our guests. So one of them is their YouTube podcast other than our favorite podcast.
And feel free to recommend ours as well. That's fine.
Yeah.
I do recommend your podcast.
A TED Talk or a book that you would recommend to our listeners?
When I was thinking about the TED Talks, one that surfaced to my mind is a TED Talk that was done by Amy Cuddy, and it's Your Body Language May Shape Who You Are. I'm not sure if you've heard that one, and it's not so much the body language component, but it's the deeper message that she goes into, which is not so much fake it till you make it, but fake it till you become it. And live it, breathe it, do it as if, and things will happen. And I think, for me, it really struck home or hit a personal note in this sense where, we're veterinarians. We are not trained to be business owners or change the world in the way that we want to change it. And you can sometimes get this imposter syndrome of, little old me, who am I to say I'm going to go out and change the way we, care for people and vets and pets as end of life nears. And that was my mission, but it was hard not to get into your head and think, how can one person change the world? So I really took on that perspective of fake it till you become it, just live it, breathe it, do it. And when you do that, it doesn't matter if you don't have a degree in business or you don't, have all of this training. Eventually you do make it because you have become it. And it has been such a powerful message to me.
And now you're simply doing a nationwide service. That's good. So the effects of that TED Talk are prominent. And before you recommend another person, I would like to throw in here that I did hear that you're raising for this initiative. So Pet Hospice, if anybody's interested, listeners, we have some powerful people, listeners of the podcast. So if anybody's interested, I think that would be a good plug to raise right now, especially services that include telehealth. I think they will grow in our economic situation. And if you can recommend a person to invite to our podcast.
Yes, I can recommend two, but they are,
we'll take two.
They're essentially kind of one anyways, but it's the Trimbles, and I'm sure you know Jess and Rob, but I see they have not been on your podcast, but I love what both of them are doing for the same reasons. Rob is really trying to take on, the Veterinary Entrepreneurship Academy is an amazing initiative matching startups and people in the pet health space with students, because, going back to that idea of, as veterinarians, we aren't given the opportunity to learn business or to learn how to do things. So I think that is a really unique approach to veterinary medicine. And then, of course, Jess, my fellow telehealth buddy, who's working so hard to integrate telehealth into practice and really imagining how that could look. And so these would be two people I would recommend.
Thank
you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.